Communication about weight with families for healthcare professionals. No matter how much education you have received, for many healthcare professionals, talking about weight-related issues with their patients is not easy. You are not alone. Lack of training, lack of self-efficacy, fear of damaging the relationship with families, concern with triggering eating disorders, and a lack of time. These are all potential barriers to talking about weight. Yet we know overweight and obesity rates are very high in children, with 1 in 3 Canadian children and adolescents meeting these criteria. Many of these children also experience related comorbidities, including physical and mental health problems. You, as healthcare professionals, are frontline caregivers tasked with the responsibility of addressing these issues. Now, what's the most effective way to do this? We reviewed the literature and met with parents and teenagers to put together these recommendations and tips for you. Let's ask Megan, a 15-year-old girl, to present the findings.
Hi, I'm Megan, and today I want to talk to you about who should talk to me and my family about my weight, who should be included in the conversation, and when to talk about it. I also have some tips to help you raise the topic. I prefer that healthcare professionals who I have known and had a relationship with for a long time address this sensitive topic with my family and me. This makes us more comfortable. I do not mind if the healthcare professional talks to me and my parents about my weight at the same time. This is ideal. But not all my friends feel the same way. Some would rather have this conversation with their healthcare professional alone first, just like we do for confidential things like sex or alcohol. Ask us alone when you first meet us and find out what we prefer. When is a good time to talk about this issue? My annual checkup is definitely the best time to talk with me about my weight. I realize that healthcare professionals may need to address it during other visits as well, but they should take extra care to do this in a sensitive manner. So how do you do this? Here are 8 tips to help you start the conversation. First, ask permission to discuss the issue with me and my family. This is a sensitive topic, and asking permission demonstrates that you understand that. This will also help me be more engaged in the conversation. For example, asking things like, "Can we take a few minutes to discuss your growth and health?" can be a good starter. You may also use a growth chart afterwards to help you guide the discussion. For example, asking, "Can I show you where your child is on the growth chart?" Or, "Can I show you where you are on the growth chart?" When using a growth chart, though, avoid setting weight goals. It can be discouraging and it is not a successful strategy. Second, focus the conversation on growth or health and on how to improve these factors, rather than on the weight itself. Encouraging and praising every small step in being active and making better nutrition choices is a more successful strategy. Third, be thoughtful in choosing words to describe my weight. Some people find the word obese insulting, even though they know it is a medical word. You might use words that me and my family use when we talk about weight. For example, my mom might say, "My daughter has carried extra weight since she was 3 years old." So you may use extra weight when replying. But don't use complicated medical terms. And I hate being called chubby. Fourth, don't judge me. Just because I carry extra weight does not necessarily mean that I am not active or that I eat tons of junk food. In fact, I do judo 5 times a week, and I love swimming. Get to know me, and do not make assumptions. Weight is related to more than just diet and activity. Fifth, it's important for me to know about any health concerns, but using scare tactics to try to get me to lose weight is not helpful, and it may only make me not want to come back. Sixth, do not encourage fad diets or strict weight loss strategies, and remind my parents not to talk about weight or dieting in front of me. Hearing my family members talk about their own weight or the size and shape of others may trigger disordered eating. Seventh, be positive, encouraging, and praise all my efforts to be healthy. Motivational interviewing may be helpful in engaging my family and me. It allows you to understand what we want, how we feel, and helps guide us in making our own positive changes. 8th, create a weight-friendly clinic by using equipment and furniture that fits everyone. So to recap, 1. Ask permission. 2. Put the focus on health, not weight. 3. Use words to describe weight carefully. 4. No judgment. 5. Don't use scare tactics. 6. No strict diets. 7. Be positive and encouraging. And 8. Create a weight-friendly clinic. Most importantly, remember that people come in different shapes and sizes, and that it does not define who they are.
Thanks, Megan. That was great. Megan and I hope that following these simple rules will help guide your discussion and make you feel more comfortable raising this sensitive topic. Your relationship with your patient is very important. What you say and how you say it matters and does make a difference.